Your blood pressure could be seconds away from crisis, and most people wouldn't even know it. A hypertensive crisis isn't just high blood pressure. It's a life-threatening spike that can cause stroke, heart attack, kidney failure, or even blindness in a matter of hours. The danger? These emergencies often start with symptoms that look ordinary: a headache, blurry vision, or even a nosebleed. Too many people dismiss them, not realizing their body is sending urgent red flag warnings. In this video, we'll reveal the 10 warning signs of a hypertensive crisis you should never ignore. Knowing them could mean the difference between survival and permanent damage. Disclaimer: this video is for educational purposes only. It's not medical advice. If you ever notice these symptoms, call emergency services immediately. In a hypertensive crisis, every second counts. Now let's begin by understanding what makes a hypertensive crisis so deadly and how it differs from ordinary high blood pressure. Understanding hypertensive crisis versus emergency. High blood pressure is often called the silent killer. Most of the time it creeps up slowly, damaging the body little by little over years. But sometimes blood pressure doesn't just rise, it skyrockets. And when it does, it can push your body into a full-blown hypertensive crisis. So what does that mean exactly? Doctors divide a hypertensive crisis into two categories: hypertensive urgency and hypertensive emergency. Hypertensive urgency. This is when blood pressure rises above 180 over 120 millimeters of mercury, but hasn't yet caused serious damage to vital organs. You may not feel well, but in many cases, there are no obvious symptoms. Hypertensive urgency is still dangerous and requires quick medical attention, but it isn't immediately life-threatening if treated properly. Hypertensive emergency. This is the true nightmare scenario. Here, blood pressure isn't just high, it's high enough to damage critical organs in real time. We're talking about your brain, heart, kidneys, and eyes. When this happens, you're not just at risk, you're already in danger. Unlike urgency, hypertensive emergencies almost always come with noticeable symptoms: headaches, vision loss, chest pain, confusion. These are signs that blood vessels are failing and organs are being injured. Why is this so dangerous? Think of your arteries like delicate pipes carrying water under pressure. Normally they can handle the flow, but if the pressure suddenly surges far beyond the limit, the pipes can leak, burst, or cause damage downstream. In the body, that kind of pressure leads to stroke, when brain vessels rupture or clog under stress; heart attack or aortic dissection, when the heart or its main artery tears under strain; kidney failure, when filtration units collapse from extreme force; blindness, when fragile vessels in the eyes rupture. Every second counts. That's why doctors call hypertensive emergencies medical time bombs. Who's most at risk? Anyone with a history of uncontrolled hypertension can experience a crisis, but the risk is especially high in people who stop taking their blood pressure medications suddenly, patients with chronic kidney disease, pregnant women with preeclampsia or eclampsia, people using drugs like cocaine, amphetamines, or even certain decongestants, older adults whose blood vessels are already weakened. That said, it can happen to anyone, even people who didn't know they had high blood pressure in the first place. The silent trap. Here's the frightening reality. Many of the warning signs of a hypertensive emergency look like everyday problems: fatigue, stress, indigestion. That's why so many people ignore them until the crisis becomes catastrophic. But here's the good news. If you know what to look for, you can act fast and prevent the worst outcomes. So let's dive into the 10 warning signs of a hypertensive crisis, beginning with one of the most common and most dangerous: the sudden, severe headache. Sign number 1, sudden, severe headache. Most headaches are harmless. Maybe you're dehydrated, stressed, or haven't slept well. But in a hypertensive crisis, a headache isn't just uncomfortable. It can be a life-threatening signal. Doctors often describe it as a thunderclap headache. It comes on suddenly like an explosion inside the skull and reaches maximum intensity within seconds. People describe it as the worst headache of their life. When blood pressure soars to crisis levels, the delicate vessels in the brain are placed under immense stress. This pressure can cause swelling, small leaks of blood, or even rupture. Sometimes it's the very first sign that a stroke is about to occur. Think of it like blowing up a balloon beyond its capacity. At first it stretches, but eventually the wall thins and risks bursting. That's what extreme pressure does to the brain's vessels. How it's different from a regular headache. Timing. It comes on suddenly, unlike a tension headache that builds gradually. Severity. Pain is extreme, often disabling. Accompanied symptoms. Nausea, vomiting, confusion, or vision changes. A regular headache might improve with rest, hydration, or over-the-counter medicine. A hypertensive crisis headache does not. If you or someone you know experiences a sudden, crushing headache, especially with a history of high blood pressure, it's an emergency. Call for help immediately. Would you know if your headache was just from stress or the first sign your brain was seconds from a stroke? That knowledge could save your life. Sign number 2, vision problems. Your eyes are windows to your health, and they're also among the first organs to show damage when blood pressure spikes into dangerous territory. Many people dismiss vision changes as eye strain or fatigue, but in a hypertensive crisis, sudden vision problems are not a minor inconvenience. They're a red alert. The retina at the back of your eye is filled with tiny, fragile blood vessels. When blood pressure shoots up, those vessels can swell, leak, or even burst. Doctors call this hypertensive retinopathy. In severe cases, swelling of the optic nerve occurs, a condition called papilledema. This means the brain itself is under enormous pressure, a medical emergency that can cause blindness if untreated. Symptoms to watch for: blurred or double vision, seeing dark spots, flashing lights, or halos; sudden loss of part of your vision, like tunnel vision; complete or partial sudden blindness. How it's different from ordinary eye issues. Eye strain from screens improves with rest. Mild blurry vision from needing glasses is gradual. But in a hypertensive crisis, vision changes appear suddenly, severely, and without relief. Your vision is precious, but this isn't just about eyesight. Vision loss during a hypertensive emergency signals that your blood vessels are under catastrophic stress, and your brain, heart, or kidneys may also be in danger. If your vision suddenly changes, don't assume it's minor. Seek emergency care right away. Quick treatment can mean the difference between recovery and permanent blindness. Would you brush off sudden blurry vision as just tired eyes, not realizing it was your body's warning of organ failure? That mistake could cost you your sight or your life. Sign number 3, chest pain or pressure. Chest pain is one of the most alarming symptoms a person can experience, and during a hypertensive crisis, it's a red siren that should never be ignored. When blood pressure spikes, the heart is forced to pump against extreme resistance. This strain can reduce blood flow through the coronary arteries, leading to angina or even a heart attack. Worse, a hypertensive emergency can trigger an aortic dissection, a life-threatening tear in the wall of the aorta, the body's largest blood vessel. This is one of the deadliest complications of uncontrolled high blood pressure. What does it feel like? Patients often describe the pain as crushing, squeezing, or heavy pressure in the chest, a sensation like an elephant sitting on the chest, pain radiating to the jaw, neck, shoulder, or left arm. This isn't the mild discomfort of indigestion or stress. It's intense, unrelenting, and often comes with sweating, nausea, dizziness, or shortness of breath. Chest pain during a hypertensive crisis signals the heart is in immediate danger. Waiting it out could cost precious minutes and your life. If you feel sudden, crushing chest pain and have high blood pressure, call emergency services immediately. Do not attempt to drive yourself. Medical teams have the tools to diagnose and treat life-threatening heart events in real time. Would you know if that chest tightness was just heartburn or the first sign of a heart attack? Knowing the difference could save your life. Sign number 4, shortness of breath. Breathing is something we rarely think about until suddenly we can't catch our breath. In the context of a hypertensive crisis, shortness of breath is a critical warning sign that your heart and lungs are under severe strain. When blood pressure reaches crisis levels, the heart may not be able to keep up. The result is fluid backing up into the lungs, a condition known as pulmonary edema. This makes breathing feel labored, as though you're drowning from the inside. What does it feel like? Sudden difficulty breathing, even at rest, needing to sit upright to catch your breath, wheezing, coughing, or frothy pink sputum in severe cases. A terrifying sensation of suffocation or tightness. This is very different from being winded after climbing stairs or anxious breathing during stress. Shortness of breath in a hypertensive emergency appears suddenly, is severe, and does not improve with rest. Shortness of breath signals that the heart is failing under extreme pressure and that the lungs are already filling with fluid. Left untreated, this can progress rapidly to complete respiratory failure. If you or someone you know develops sudden, unexplained shortness of breath, along with high blood pressure, treat it as an emergency. Call for immediate help. Doctors can provide oxygen and powerful IV medications to quickly reduce blood pressure and remove excess fluid from the lungs. Would you brush off sudden breathlessness as simple exhaustion, or recognize it as your heart's desperate cry for help? That recognition could be the difference between survival and tragedy. Sign number 5, neurological symptoms. Your brain is one of the most sensitive organs to high blood pressure. During a hypertensive crisis, the sudden pressure surge can overwhelm delicate brain vessels, leading to swelling, bleeding, or blocked blood flow. This is why neurological symptoms are among the most dangerous red flags. When blood pressure spikes, small brain vessels may rupture or leak, causing hemorrhage. Others may clamp down, cutting off oxygen supply. The result can be a stroke or a condition called hypertensive encephalopathy, where the brain literally malfunctions under pressure. Symptoms to watch for: confusion or disorientation, suddenly not knowing where you are or what you were doing. Difficulty speaking, slurred or jumbled words. Weakness or numbness, especially on one side of the face or body. Loss of coordination or dizziness. Seizures or sudden loss of consciousness. These symptoms appear suddenly and severely. They're not caused by fatigue or stress. They are emergency alarms. Brain cells begin to die within minutes when starved of oxygen. That's why doctors use the phrase, "time lost is brain lost." Ignoring these signs could mean lifelong disability or death. If confusion, slurred speech, weakness, or seizures occur in the setting of high blood pressure, call emergency services immediately. Rapid treatment is the only chance to preserve brain function. Would you recognize if a loved one's sudden confusion was just tiredness or the first sign of a stroke? Spotting that difference could save their future or their life. Sign number 6, severe anxiety or feeling of impending doom. Anxiety is something most people experience, but during a hypertensive crisis, the sudden onset of severe anxiety or a feeling of impending doom can be a powerful and often overlooked warning sign. When blood pressure explodes to dangerous levels, the body releases a flood of stress hormones like adrenaline. This sends your nervous system into overdrive. Your heart races, your chest feels tight, and an overwhelming sense of dread may take hold. Many patients describe it as an eerie, unmistakable feeling that something is very wrong. Doctors often hear phrases like, "I felt like I was about to die," even before other symptoms appear. How it differs from ordinary anxiety. Timing. Crisis anxiety comes on suddenly, not gradually. Intensity. It feels overwhelming, often accompanied by physical symptoms like sweating, palpitations, chest tightness, or shortness of breath. Context. It may appear alongside other hypertensive crisis symptoms like headache, vision loss, or chest pain. This is not a panic attack caused by stress. It is your body's survival system sounding the alarm. Many people dismiss severe anxiety as just nerves, but in the setting of dangerously high blood pressure, it can be a clue that organs are already in distress. Ignoring it could mean missing the earliest sign of a crisis. If sudden, severe anxiety strikes out of nowhere, especially if you have hypertension or other symptoms, take it seriously. Call for emergency help. Doctors can determine whether it's a hypertensive crisis or another medical emergency. Would you dismiss that overwhelming sense of dread as just stress, not realizing it was your body screaming for help? That one mistake could cost your life. Sign number 7, nausea and vomiting. Most people associate nausea or vomiting with food poisoning, a virus, or motion sickness. But in a hypertensive crisis, these symptoms can be far more serious, signs that the brain and other organs are under extreme stress. When blood pressure surges to dangerous levels, it increases intracranial pressure, the pressure inside the skull. This affects the brain centers that control balance and digestion, leading to sudden nausea and vomiting. In some cases, vomiting is accompanied by a crushing headache, vision problems, or confusion, all signs that the brain is struggling to cope with dangerously high pressure. How it differs from ordinary stomach upset. Timing. Hypertensive crisis nausea strikes suddenly, not after a bad meal. Accompanying symptoms. It often appears with neurological changes, headache, or vision loss. Response. Unlike simple food-related nausea, it does not improve with rest, hydration, or over-the-counter remedies. Vomiting during a hypertensive crisis is a red flag that the brain may be swelling or bleeding. Ignoring it could allow catastrophic damage to occur. If you or someone else experiences sudden nausea or vomiting alongside extremely high blood pressure or other crisis symptoms, seek emergency care immediately. Would you dismiss sudden vomiting as a stomach bug, not realizing it was your brain under attack? That mistake could cost a life. Sign number 8. Nosebleeds. Nosebleeds are common and often harmless. Dry air, allergies, or minor irritation can trigger them. But in a hypertensive crisis, a sudden severe nosebleed may be a sign your blood vessels are reaching their breaking point. The small blood vessels inside the nose are fragile. When blood pressure soars, the intense pressure can rupture these vessels, leading to heavy bleeding that's difficult to stop. This isn't the occasional nosebleed that clears quickly. In a hypertensive crisis, the bleeding can be intense, persistent, and accompanied by other serious symptoms. Intensity. Bleeding is heavier and harder to control. Timing. It often starts suddenly without obvious cause. Context. It appears alongside other crisis signs like headache, vision changes, or chest pain. A nosebleed by itself doesn't always mean an emergency. But in the setting of severely high blood pressure, it's a dangerous red flag. It means your blood vessels are under extreme stress, and if tiny vessels in your nose are rupturing, bigger vessels in the brain, eyes, or heart could be next. If you experience a sudden, severe nosebleed and know your blood pressure is dangerously high, don't dismiss it. Seek emergency care immediately, especially if other warning signs are present. Would you see a nosebleed as harmless, not realizing it was your body's alarm before something far worse? Recognizing that difference could save your life. Sign number 9, signs of kidney damage. Your kidneys quietly filter waste and balance fluids every second of the day. But during a hypertensive crisis, they are among the first organs to suffer. The sudden pressure surge can overwhelm the delicate blood vessels inside the kidneys, leading to rapid and sometimes irreversible damage. The kidneys rely on a network of fine vessels called glomeruli to filter blood. When blood pressure skyrockets, these fragile vessels can rupture or scar, disrupting filtration. This leads to dangerous changes in urine output and composition. Symptoms to watch for. Blood in the urine, a sign of ruptured vessels. Foamy or dark urine, due to protein leaking through damaged filters. Very little urine output, kidneys shutting down. Swelling in ankles, legs, or around the eyes, fluid buildup from poor kidney function. How it differs from ordinary issues. Mild swelling or urinary changes can result from dehydration or diet, but when these appear suddenly alongside very high blood pressure, they are serious warning signs of organ damage. Kidney damage from a hypertensive crisis can progress to acute kidney failure, requiring dialysis or leading to death. Ignoring these signs gives the crisis more time to destroy vital organs. If you notice sudden changes in urine or unexplained swelling with high blood pressure, treat it as an emergency and get medical help immediately. Would you dismiss blood in your urine as just something you ate, not realizing your kidneys were collapsing under pressure? That one oversight could cost your life. Sign number 10, sudden weakness or collapse. Perhaps the most dramatic and terrifying sign of a hypertensive crisis is sudden weakness, fainting, or collapse. This is the body's last and most urgent alarm. A sudden collapse can occur for several reasons during a crisis. A stroke cutting off oxygen to part of the brain. A heart attack reduces blood flow to the brain, an aortic dissection causing catastrophic bleeding, severe arrhythmias triggered by extreme pressure. When the brain or heart cannot get enough blood, the body simply shuts down. Symptoms to watch for: sudden inability to move part of the body, collapse without warning, brief loss of consciousness or fainting, extreme weakness, dizziness, or inability to stand. How it differs from ordinary fainting. Ordinary fainting often occurs from standing too long, dehydration, or heat, and people usually recover quickly. In a hypertensive crisis, collapse is sudden, severe, and accompanied by other symptoms like chest pain, headache, or vision loss. Collapse during a hypertensive crisis often signals a life-threatening event already in progress. Waiting or seeing if it passes can be fatal. If someone collapses and you suspect a hypertensive crisis, call emergency services immediately. If they are unresponsive, begin CPR if trained until medical help arrives. Would you think someone just fainted, not realizing their brain or heart was failing under extreme pressure? Recognizing the difference could save their life in that critical moment. The long-term consequences of ignoring the warning signs. Recognizing the 10 warning signs of a hypertensive crisis is only half the battle. The other half is understanding what happens if these signs are ignored and why acting quickly is non-negotiable. The truth is, the consequences of waiting too long are not just immediate, they can last a lifetime. Stroke, the silent thief of independence. When blood pressure ruptures or blocks vessels in the brain, the result is a stroke. Survivors often live with permanent disabilities, weakness or paralysis on one side, slurred speech, difficulty walking, or even the inability to recognize loved ones. Doctors warn, minutes can mean the difference between a full recovery and a lifetime of disability. A delay of even 1 hour in seeking help can steal decades of independence. Heart failure and sudden cardiac death. During a hypertensive crisis, the heart works harder than ever. Over time, this strain weakens the heart muscle, leading to heart failure. Survivors may spend the rest of their lives on oxygen, restricted from climbing stairs, or unable to walk across a room without gasping for breath. For some, the crisis ends instantly with sudden cardiac arrest. Kidney failure and dialysis. Your kidneys are fragile filters, and once they fail, the damage is often permanent. Many who survive a hypertensive crisis without prompt treatment end up needing dialysis 3 times a week just to stay alive. Imagine being tethered to a machine for hours every few days for the rest of your life simply because the warning signs were ignored. Permanent vision loss. Hypertensive emergencies can destroy the delicate blood vessels in the eyes, causing blindness. And unlike glasses or cataracts, this vision loss is irreversible. Once the retina or optic nerve is damaged, the gift of sight may be gone forever. Emotional and family impact. These aren't just medical outcomes, they affect families deeply. A stroke survivor may never return to work, placing financial stress on loved ones. Kidney failure can make travel impossible. Heart failure means constant fatigue and hospital visits. The ripple effect of ignoring a hypertensive crisis reaches far beyond the patient. Why acting immediately changes everything. The encouraging part is this: when people act quickly, doctors can often reverse the crisis, lower blood pressure safely, and prevent permanent damage. The difference between acting and ignoring is the difference between walking out of a hospital on your own 2 feet or leaving in a wheelchair, or worse. What to do if you notice these signs. Now that you know the 10 critical warning signs of a hypertensive crisis, the most important question becomes, what should you do if you or someone you love experiences them? The answer can literally save a life. 1. Call emergency services immediately. The single most important step is to call emergency services right away. Whether it's 911 in the US or your local number, don't hesitate. Why? Because a hypertensive emergency is not something you can manage at home. Every passing minute puts the brain, heart, kidneys, and eyes at greater risk of permanent damage. Doctors emphasize this point. Don't drive yourself. Don't wait for it to pass. Call for help immediately. 2. Do not self-medicate. Many people make the mistake of grabbing extra doses of their blood pressure pills, hoping to bring the numbers down quickly. This is dangerous. Some medications work too slowly, while others, if taken incorrectly, can cause blood pressure to plummet, leading to shock or even death. The right treatment for a hypertensive emergency involves intravenous medications carefully monitored by doctors in a hospital setting. 3. Stay calm but act quickly. Panic makes things worse. When you panic, adrenaline surges, driving blood pressure even higher. While waiting for help, sit upright to make breathing easier. Take slow, deep breaths. Avoid unnecessary movement. If someone else is experiencing the crisis, stay with them and reassure them until help arrives. 4. Know what not to do. Don't ignore the symptoms, even if they seem mild. Don't try to tough it out or hope it goes away. Don't waste time searching the internet for home remedies. Don't drive yourself to the ER if you are experiencing chest pain, neurological symptoms, or vision loss. It's too risky. 5. What to expect at the hospital. Doctors will measure your blood pressure continuously, run tests to check for organ damage, like brain scans, heart monitoring, kidney function tests, and eye exams. Administer intravenous medications to gradually and safely lower your blood pressure. Provide oxygen, fluids, or other support depending on your symptoms. The goal is not just to lower the numbers, but to protect your organs from further harm. 6. Acting quickly saves futures. Remember, the difference between permanent damage and full recovery often comes down to how fast you act. If you wait too long, the crisis may leave behind a lifetime of complications: paralysis, blindness, dialysis, or heart failure. But if you act immediately, many people walk out of the hospital with their health intact. So here's the big question. If these symptoms happen to you tonight, would you know exactly what to do? Now you do, and that knowledge could save your life. Conclusion. A hypertensive crisis isn't just high blood pressure. It's a medical emergency that can damage your brain, heart, kidneys, and eyes in a matter of hours. The 10 warning signs we covered: sudden severe headache, vision problems, chest pain, shortness of breath, neurological symptoms, overwhelming anxiety, nausea, nosebleeds, kidney damage clues, and sudden weakness or collapse are not random. They are your body's urgent alarms. The message is clear. Never ignore these symptoms. They aren't inconveniences. They aren't something to wait out. They're warnings that your life is in danger. Acting quickly, calling emergency services, avoiding self-medicating, and getting professional care can mean the difference between survival and tragedy. Here's what you can do right now. If this video opened your eyes, hit the like button. It helps more people discover life-saving information. Subscribe to our channel and turn on the notification bell so you never miss our doctor-approved health insights. Share this video with your family and friends. Someone you know could be at risk, and this knowledge could save their life. And I want to hear from you. Have you or someone close to you ever experienced high blood pressure symptoms that turned out to be serious? Share your story in the comments. Your experience could help others recognize the danger before it's too late. Remember, in a hypertensive crisis, every second matters. Don't wait. Don't ignore the signs. Listen to your body, take action, and protect your future. Because when it comes to your health, your life is worth every minute.